Hello? Yes, please come in. I think I was waiting for you, right? Okay. So, you are the one that we've got the results already, yes? From the research, from your haircut. Yes. Okay, so just please give me a couple of moments. I'm going to check, okay, what kind of results did you get, and then it will be clear what kind of procedure we will be doing for you today. Good. Yes, I see. Yeah, on the computer. Okay, that's kind of clear. So just a quick look at your hair. Yes, they are kind of. The thing is that your hair are wavy. They tend to get curly, right? Yes, and it means that you need to make your hair more not wet, but to use some kind of a conditioning. Yes, masks. Exactly, you got me right. Because the wavy hair, they always tend to be more dry. And the thing that we are going to do today is that we are going to make you some layers, okay? I will cut your hair. Yes, I know that you do not want to lose a lot of length, but if we will not make your hair to fall, this kind of with the easy waves, because a huge length gives the weight to your hair, and that weight, it makes your hair break. Yes, and then the ends of your hair, they tend to get really dry, and then you need to cut a lot of them. Yes, so the length, we will not do a lot of cutting here, but we will need to do some layering, okay? Okay. So, I want to say sorry, apologize for those sounds that you may be hearing. All the windows are closed, definitely. It's winter time, it's very cold, but they are huge machines. They are cleaning the parking. Yes. Yeah. And as it is winter, a lot of snow currently, a lot of cold, a huge minus outside. I'm going to do some kind of a therapy, some kind of a oil to your hair, to your roots, because they need to get a really good feed. Yeah, they need to be fed. Yeah, in our language. Okay, so let me get to work. Good. Your hair, they look like they lack actually some kind of minerals, so that is why we've got some tinctures for you ready, and you will take them with you today, and you will start to consume them, okay? Yes, exactly. Sometimes, I just have a question, if you don't mind. Am I right that maybe got, you've given birth to children, maybe to a child recently? Okay, I see. Because that is actually mineralizing. It's quite a problem, an issue for newly made moms. Yes. And how old right now is your child? Yes. How old? Is it a girl or a boy? Congratulations. Yes. So, are you breastfeeding? Okay. I see. Yeah. Well, those little babies, they really need a lot of vitamins and minerals, and your milk currently is their only food. So that is why your body, your organism, it needs to, did you know that your nipple gets the signals from your baby's saliva? Yeah, that's really interesting. It's very super clever how our bodies are working very symbiotically, right? Yes, and when it knows what kind of minerals to prepare for your baby, your body provides it for your baby. So your body means it may lack, especially if you're not drinking any vitamins, if you're not drinking any minerals, so at least you need to be consuming prenatal minerals for the breastfeeding moms also, okay? And of course the tinctures. So these are 2 bottles of the tinctures. You will see on the label that one is being used, for the morning and for the evening, and the other one is just by the bigger dose in the morning, excuse me. So you will just dissolve it in your water and you will sip it, okay? Yes, you will see here, it contains, it contains here a lot of herbs, so it's very natural product. It will balance your hormonal system. Great. Now, okay. Let's start from the trimming, alright? And then we are going to proceed with some. Okay, I will stand a bit. Oh, you may not worry. It's normal that you are going to fall asleep even. A lot of newly made moms, they are coming and they are falling asleep because this is a little hour only to yourself. That's very rare, you know. Yes, we have no worries. I will do my job, and when I finish, I will let you know. Okay. Good. Yeah, totally relax. I just hope that those sounds don't disturb you a lot. Of course, it's not a baby cry, but you know. Okay, now the next. The other side. Yes, I do believe that you may come to cut your hair maybe every 3 months. This is for the very beginning, while you start consuming those tinctures, you know. And then I think that every 6 months should be enough. It really may happen that your hair will start growing faster than it used to. So if that happens, you know, you just become more rare. You will have more space, you know, between your cuts. Good. Yeah, just a little. Yeah, I want you to stay, you know, not tilted to one of the sides. Just as straight as you can. Okay. Now I'm going to check a bit your scalp. Good, the situation is kind of good. Yeah, it's not, there's no dandruff. It's not itchy. Yeah, it's not dry. I mean, there's only the thing with your mineral lacking here and the waviness of it. I'm going to put some gloves because as I've said, I'm going to put some oil, some warming oil. It will be the base of it. It's rosemary to enhance your hair growth. Okay, I will put it on your scalp, on your roots. Okay. Alright. Just here, and I'm gonna make your skin really absorb this oil and all the components of it. Good. I've also sent you an email in which you will find all the explanations how to use the tinctures, what kind of minerals, just a friendly reminder, what kind of minerals you may buy to yourself. And then I also left for you an explanation there regarding the retinol or vitamin A, how it works with our hormonal system, and when we are lacking of it, then one of the symptoms usually is the loss of your hair. Yes, the thing that you mentioned. That's very normal when you became a mother, and I've said your body just lacks the specific minerals. So the base for the tinctures, even, I would say, is the bee pollen. Yes, you may buy it mostly everywhere. The bee pollen, just a teaspoon, each morning, and then the fish oil. I've left there also some recommendations about a good quality fish oil. So yeah, clean fish oil. The best is when you get the fish oil of the fish liver. Yes, I'm going to also put on your hair some liquid for your treatment. Okay, just on your scalp. It may feel a bit warm, yeah. The liquid is warm. Good. Then I'm going to wrap it. Okay, good. You do not need to wash it or clean it in any way. It's really being absorbed very well. your hair and by your scalp. We'll just go through with the slide. Just check again, one more time, how it all looks like. Okay. Yes, okay, good. Great. Yes, you feel it as a tingly massage. That's very nice for your hair growth as well, because you're stimulating, yeah. You may do it in your shower, or just, when you lay, or when you are breastfeeding your baby. Okay, the last thing for today's treatment is the foam. I will a bit style your hair. Yes. Yeah, it smells really well. Yeah, really good. Your hair. Yes, I've told you, you're not going to lose any length. Okay. Good. Well, you may come for this treatment just, as often as you will be coming for your haircut. Yeah. Because, each time we cut a bit of your hair, we are, let's call it, livening your hair. And that is why it's the best time to put such natural cosmetics. Yes. Because your hair then is capable of absorbing it fully. Okay. So, let me brush a bit. Yes, of course, you may speak with your hair each time. Each time you are brushing them or cleaning or just stroking, You see, they got now even more wavy. That's because you've got layers right now. And I believe it's you too, even better, But that's the look of the healthy hair. Yes. Amazing. Okay. Perfect. So, just okay. So I will brush a bit here, all the hair. Okay. Taking it off from you. Good. So it was nice to see you, even for such a short time. Yeah, get back to your baby. See you next time, sure. Bye.